Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today we're talking about retinal detachment or detached retina. Dr. Sharon, is that the one you have to lay flat on your face with your face in a pillow, like in a donut pillow? No, it's not the one you have to do that. So if you didn't know that, if you did not know that, you might want to watch this video coming right up. Hello, Clinic Review family. I hope you're doing well. Today we're talking about detached retina. Again, we're doing Blue Book. It is found on Amazon under the Blue Book, y'all. That's the name of it. I work with the greater Clinic organization, Clinic Reviews. Mark Clinic is the GOAT of NCLEX preparation. You can go to Clinic Reviews and find out more about our on-demand review or our streaming service or our small group tutoring. All right. So today we're talking about detached retina. I had nobody tell me get rid of Florence last time, so we're keeping Florence. I had one person say, move her over next to the lion. I agree. I think she'd look good next to the lion, but if I move her, then you won't be able to see that picture very well. And that's a picture of me and my mom and my daughter and my grandson from about 2 years ago. Is it my daughter's wedding shower. So I'll leave that up for a little while, eventually switch that picture up, and maybe I will move Florence over there when I switch that picture up. So today we're talking about retinal detachment. This is not the one where you have to lay flat on your face on a donut pillow so that you reduce pressure, any of that stuff. So I just want to make sure you do know what it is. I don't usually do this when I do Blue Book teaching, but the retina is that thin layer that kind of attaches to the back of the eye, right? And so when it detaches, it just detaches from that and it kind of falls down. And I didn't include pictures. You can look in the eye and you can actually see it kind of falling down. You can Google retinal detachment. You can look at all the pictures. I just wanted you to know what it is. And it does cause a lot of problems with vision. They can eventually completely lose their vision if they don't get it taken care of. And it doesn't take long. Once it starts to detach, the entire thing can eventually become detached. So it's not a small thing that this would happen. So let's go ahead and jump in with the questions after just explaining to you what it is. You know that I teach this information because it's in the Blue Book, and the Blue Book is facts. It's just facts with no questions. I mean, they're like flashcard questions, right? Like, what is this? And then it gives you the answer. What is this? And then it gives you the answer. That's what the Blue Book is about. But we don't have any NCLEX style questions. And Mark wrote the Blue Book. You have to know the content in the Blue Book. But I created questions to go along with it so that you can see how the information can be used. I do recommend getting the Blue Book because there's a lot of information in there, and I won't be covering 100% of it. Which of the following patients is at the highest risk for developing retinal detachment? A 25-year-old female with a history of Crohn's disease, a 60-year-old male with a history of head trauma, 45-year-old female with a history of myocardial infarction, a 30-year-old male with a history of seasonal allergies. So age increases the risk. Extreme myopia increases your risk. So myopia is nearsightedness. So extreme myopia increases your risk. Head trauma increases your risk. And cataract surgery increases your risk. So these are common things that can increase your risk. So the correct answer is a 60-year-old male. That's the oldest one. So we go, well, the age is a risk factor. And the history of head trauma is also a risk factor. So trauma to the head is also a risk factor. A patient presents with suspected retinal detachment. Which of the following symptoms support this diagnosis? So what symptoms are they going to have? Headache, blurry vision, or eye pain, blurry vision and poor night vision, a veil curtain in the line of sight, spots in the vision, sensitivity to light, or cloudy vision. So I did use this as an opportunity to teach you what is what. So glaucoma, which is increased intraocular pressure, that's glaucoma, is more likely to experience the headache, blurry vision, and eye pain. Okay, so because that's increased intraocular pressure. Macular degeneration, they see a lot of vision changes, but they don't see the veil or the curtain in the line of sight. So when that retina becomes detached, where it's detached at tends to have this kind of veil or a curtain over that. So it looks like everything's foggy when you're looking at it. And it's not that you see, it's not like cataract where you see the cloudiness over their eye, that's a cataract where we can see the cloudiness over their eye. But for them, they actually, for retinal detachment, they actually feel like they're looking through a veil in that light of sight. And they also a lot of flashing lights and spots in their vision. That's retinal detachment, whereas macular degeneration can have blurry vision and port night vision. And those are macular degeneration has more vague symptoms. Okay. So I don't think you're going to get tested on macular degeneration as far as the signs and symptoms of it because they're super vague. But retinal detachment is pretty clearly that veil or curtain in the line of sight. That's a very common symptom. And then spots, flashing lights, those kind of things are very common symptoms. And then cataract is what the most common vision problem in the United States, that they'll have sensitivity to light. They'll have cloudy vision. They'll have that that looks like the white film over their eyes and that kind of thing. A 70-year-old patient with a history of cataract surgery reports sudden vision loss and floaters in the affected eye. What should be the nurse's first action? So when I see this, I say, well, they're 70 years old and they had cataract surgery, puts them at risk for retinal detachment. These are risk factors. And now they have sudden vision loss and floaters in the affected eye. And I go, that sounds like retinal detachment to me. So then what should I do first? Okay. Provide reassurance and schedule a follow-up appointment. No, I got to take action here. You can't mess around with retinal detachment. Administer eye drops to reduce intraocular pressure. No, that's glaucoma. That's not retinal detachment. Contact the ophthalmologist immediately. Yes. Implement bed rest and dim lights. Yes. So when someone has retinal detachment, you have to decrease all activity because any movement is going to increase their risk for it to continue to detach, and lights and eye movement. You can put patches over their eyes, tell them to close their eyes and don't move their eyeballs around, right? You want to have total decreased stimulation. So I want to do both C and D. So would I contact the ophthalmologist and then implement bed rest and dim the lights, or would I implement bed rest and dim the lights and then contact the ophthalmologist? Y'all, I got to tell you what I would do first is implement bed rest and dim the lights. So as soon as they tell me that they're having a vision loss and floaters, I say, don't get out of bed. I turn off all the lights, say, close your eyes, don't look around. I'm going to go call the doctor now. So it's a first question. First is why I'm picking D. Now I want to show you, this is a different question. A 70-year-old patient with a history of cataract surgery reports sudden vision loss and floaters in the affected eye. What is the priority nursing action? Y'all, priority is best. Now, sometimes first and best questions are answered the same, but not always. And you have to think about it. I have the same exact answers. So obviously A and B are out. And I say, well, I want to contact the ophthalmologist immediately and implement bed rest. But this is a best question, not a first question, which means I cannot do them both. I'm only allowed to do one. That's what priority means, or best. That means if you're only allowed to do one thing, what one thing do you have to do? Y'all, I have to contact the ophthalmologist immediately. I have to do that. That's what's best. But if I'm going with what's first, then I'm going to implement bed rest and dim the lights. And then I'll call the ophthalmologist. Okay. A patient with a history of retinal detachment in one eye reports similar symptoms in the other eye. What's the priority nursing action? Well, I say, well, if they had retinal detachment in one eye and now they're having the same symptoms in the other eye, they probably got retinal detachment. What do I do for retinal detachment? Well, I got to rest. I got to turn off the lights, put them on bed rest. Say, don't move your eyes, maybe cover their eyes if I can. And I need to make sure they see somebody about this, right? I don't know if I'm in the hospital. I don't know where we are. So it's just a general question. So I got to decrease all stimulation. I need to get them to see somebody. So this is a priority nursing action. So it's a best question. So what am I going to do? Let's see what the answers are. Arrange for an immediate consultation with an ophthalmologist. Absolutely. Document the symptoms and instruct the patient to follow up in a week. No, we can't follow up in a week. Document the symptoms. Yes. Instruct them to follow up in a week. No. Place an eye patch on the affected eye and monitor for changes. Y'all, you never place an eye patch on just one eye if you want them to decrease stimulation, because placing an eye patch on one eye, they're still going to move their eyes around. So if you want decreased stimulation and decreased movement, you have to put patches over both eyes. So I could put patches over both eyes, but the one eye patch isn't going to do them any good. So I'm not going to do C at all. That's not a good answer. Administer anti-inflammatory eye drops to reduce symptoms. That's not going to reduce any of the symptoms. So the priority here is to arrange for immediate consult with an ophthalmologist. Which of the following patients should be advised about the signs of retinal detachment due to their high risk? Now, yes, this is a repeat question. I already taught you this. So do you know what the right answer is, right? A 40-year-old patient with a history of migraines, a 50-year-old patient with previous cataract surgery, a 35-year-old pregnant woman, a 28-year-old patient with a history of seasonal allergies. Who's at risk here for retinal detachment? I already taught you that. Okay, the person's the oldest age and they had previous cataract surgery, so they're at risk. Prior to laser photocoagulation for retinal detachment, which of the following instructions should the nurse provide to the patient? You will be under general anesthesia for this procedure. You may feel a slight pressure during the procedure. Expect to stay overnight in the hospital after the procedure. Do not take any of your regular medications on the day of the procedure. So what do? If you get them an appointment with an ophthalmologist, what are they going to do about it? They're going to take them for laser surgery. That's primarily, can they do actual surgery where they have general anesthesia? They can. That is in the blue book. I'm not going to talk about it. My dog is right here if you see me doing something weird with my hand. So they're going to do a laser surgery, and it's called laser photocoagulation. It's also called cryosurgery or freezing. These are all synonyms. Laser photocoagulation, cryosurgery, freezing, all synonyms. And it is not a surgery, as in they're not going to have any anesthesia. They just numb the eye. They give them a medication to dilate the pupil, and they just do a laser. So the patient is awake during the entire thing. It's similar to what they do when you have the laser surgery for vision improvement, like if you're nearsighted or farsighted, and they do, I can't remember what it's called, that laser surgery where they make your vision better. It's the same thing. Okay. It's the same type of surgery. So which of the following instructions should the nurse provide to the patient? You'll be under general anesthesia. No, they're not going to be under general anesthesia. You may feel slight pressure during the procedure. Yes, because even though they numb the eye, they can still feel something going on there. They're also going to see a bright light too, by the way. Expect to stay overnight in the hospital. No, it's an outpatient procedure. Do not take any of your No, we don't tell people don't take your regular meds on the day of a procedure. We say take all your regular meds, right? So they don't even have to be NPO. Now, we may say don't eat or drink anything for the hour or two before surgery, just so you don't kind of feel nauseated with everything that's going on. You're going to have bright lights and all kind of stuff, but they don't have to be NPO for this. What is the priority nursing action immediately after a patient has undergone laser photocoagulation for retinal detachment? All right, so they've had the procedure. What are we going to do afterwards? Priority. I can only do one thing. What one thing do I have to do? Administer prescribed pain medicine, position the patient in a prone position, assessing the patient's vision in the treated eye, apply an eye patch to the affected area. Y'all, this is not the surgery where they have to be prone with their face in a donut pillow. Okay, proning is on your face. No, you don't have to do this. Is not that one. So we're crossing off B. They don't have much pain. So unless they tell me they're like having a pain, I'm not going to prioritize giving pain medication. Assess the patient's vision in the treated eye. Well, yeah, we just put a laser into that eye. So of course I'm going to need to stay, and they have vision in the eye, y'all. They're awake the entire time. The eye is open. It's held open, so they can't close it. And they do this, they dilate the pupil, they numb it. So they don't feel a lot, but they see the light. And you check the vision. Do you have a lot of what's going on? How's your vision? Has it improved at all? Apply an eye patch to the affected eye. Again, if you apply an eye patch, it has to go to both eyes, not one. And even if it said apply eye patches to both eyes, even if it said that, I wouldn't pick it. Because if I can only do one thing, I have to check the vision in the treated eye. I have to do that. I got to know, are they better? Are they worse? What's going on? Next question. After teaching a patient who had a retinal detachment about post-cryosurgery care, which of the following statements requires further teaching? All right, remember, laser photocoagulation means the same thing as cryosurgery, which means the same thing as a freezing procedure, freezing the eye. The laser is extremely cold. I don't understand it all, y'all. Don't ask me to explain it, actually. It's somehow super cold. So those are all kind of synonyms, right? So after teaching a patient who had this procedure, which of the following statements requires further teaching? So I'm looking for the false statement. I will need to wear an eye patch over the treated eye for several days. That's false. If they wear an eye patch, it's going to be over both eyes. It could be just a post-procedure bandage. They may or may not have to wear it, but if they wear it, it's going to be over both eyes, not just one. I may experience some tearing. That's not tearing, that's tearing. Probably hard to tell. They're spelled the same. I never thought of that before. Tearing and mild pain after the procedure. That's true. Tears are going to produce more tears, and they could have mild pain after the procedure. I will not be able to return to work for at least 3 weeks. That's true. Now, I have seen some books where it talks about you can need to wait a week. If your only option, like if they say how long till they can return to work, it's not the day of, it's not the next day, it's not 2 days after. It's you have to give the eye time to heal. 3 weeks is the best time frame. If they have a highly active job, like where they could have increased interocular pressure or a lot of heavy lifting or anything like that, the doctor may ask them to wait longer. But 3 weeks is really your ideal time frame. I understand my vision may still be impaired even after full healing. It could be. Their vision could still be impaired. They just it won't get any worse. Okay. So it doesn't necessarily restore healing because they can't reattach the retina. All they can do is cause a scar to appear. That laser causes a scar to appear so that it doesn't continue tearing. So the one that's false, the further teaching statement is A. Again, 3 weeks is your ideal time frame. So don't go, well, I think it could be 1. No, well, I think the books that I've seen it say 1 weekend, I think they're wrong. Okay, Mark says 3 weeks. I've never known Mark to be wrong about these things ever. He's never been wrong compared to somebody else. When somebody else says, I think it's this, whatever Mark says, y'all, he's always right. Always. So I would go with the 3 weeks, even if you see it a different number somewhere else. Following laser photocoagulation, the patient reports mild discomfort and a headache. What is the appropriate nursing intervention? Okay, mild discomfort and a headache. So what do you think? Do you think that's normal or not? Mild discomfort, I already know that's normal. They could have some slight pain. How about a headache? They just put a laser into their eye. I think a headache could definitely be a possibility. That, to me, sounds like a normal response afterwards. So administer acetaminophen as prescribed. Well, that's an appropriate intervention. Apply cold compress to the treated eye. Well, do we want to vasoconstrict the area that we just had surgery on? I don't really want to vasoconstrict the area I just had surgery on. Not really want to do that. Notify the ophthalmologist. Well, I don't notify the ophthalmologist of expected findings. The nurse is supposed to treat expected findings, and these sound like expected findings. Encourage the patient to take deep breaths to relax. No, that just increases interocular pressure, and I really don't want to do that. So I'm going to give the acetaminophen as prescribed. Before laser photocoagulation, the nurse administers a mydriatic eye drop. What is the purpose of this medication? So I'm testing vocabulary here. Do you know mydriasis? Mydriasis, the D, mydriasis. The D in mydriasis goes with the D in dilation. So mydriatic, and I don't know if this is spelled right. It might be M-I-D. I'm not for sure. I might have it spelled wrong. A mydriatic eye drop with a D dilation. To anesthetize the eye, no. To reduce intraocular pressure, no. To prevent infection, no. To dilate the pupil, there we go. The D in dilate is the D in mydriatic or mydriasis, pupillary dilation. A patient complains of floaters in their vision after laser photocoagulation for retinal detachment. What is the priority nursing response? Reassure the patient this is a common side effect and should decrease over time. Contact the healthcare provider immediately. Administer prescribed eye drops. Encourage the patient to rest and monitor for any changes. So there's no eye drops for floaters. So I'm crossing that off. And we already know that the eye vision may not totally correct itself. It just, this photocoagulation, laser photocoagulation prevents the tearing from getting worse. So I'm not going to contact the healthcare provider because I'm not surprised that they have floaters. So if I can only do one thing, because it's priority, it's best. Do I want to say, well, you need to rest and let me know if anything changes? Or do I go, well, no, this is common side effect. Y'all, if I can only say one thing, I have to tell him it's a common side effect. I have to tell him that. It should decrease over time. Doesn't mean it's going to completely go away, but it should decrease over time. Remember that we're not totally correcting the problem, but they should decrease. They should have fewer floaters than what they had before. So if I can only do one thing, I got to reassure them that this is normal. That's what I have to do after surgery. What should the nurse include in the discharge instructions for a patient who has undergone a freezing procedure for retinal detachment? I changed some of these words around because I wanted you to get used to the different vocabulary words all associated with the same procedure. Laser photocoagulation, cryosurgery, freezing, these all mean the same thing. So they just underwent the freezing procedure. What should the nurse include in the discharge instructions? Avoid bending over or lifting heavy objects for a few days. That sounds like a good idea because that just increases intraocular pressure. You can resume wearing contact lenses tomorrow. Absolutely not. You should sleep with your head elevated, reduce swelling. There's no swelling issues associated with that. You don't have to sleep any particular way. You will not need any follow-up appointments after this procedure. Well, that's false. That's false. So you might go, well, shouldn't they avoid bending over or lifting heavy objects for 3 weeks? That would be a better answer, but A is better than all the other answers, y'all. So what you do is if you go, well, it doesn't say three weeks, so I can't pick it. No, all the other answers are clearly wrong. Pick the answer that's closest to what you know to be true. Okay. You have to get that kind of as a standard as you're taking this test. You have to think what answer is closest to what I know to be true. Otherwise, you're going to reject correct answers because it doesn't say the exact thing that you want. It is not at all uncommon. I should say it is common for me to pick an answer after ruling out the other answers. Sometimes frequently, I read all 4 answers and I go, I'm not sure what the right answer is, but I know B, C, and D are all wrong, so I guess I better pick A. Use that as a strategy. Use your clinical reasoning, okay? All right. Well, I hope this was helpful to you and have a great rest of your day. I'll talk to you later. Bye.